Hey everyone, I hope that you are keeping safe during this time. The tip for this Tuesday is how to do well on step 2 CK. I will open up this conversation to let you know that the more clinical experience that you have up to the point of studying for step 2 CK will definitely benefit you in terms of answering the questions on CK. I'll tell you why. If you are familiar with rotating in certain specialties, you will learn a lot about those specialties and a lot of current things that are going on. That will help you greatly, so it's great to have in your back pocket. That being said, you're probably not doing elective experiences in all specialties, so make sure you familiarize yourself with them. It's better to coordinate this exam with your final year of medicine, only because you've literally gone through them in terms of the different specialties in depth and been tested on them for your core rotations at school. In addition to this, I would also like you to recognize that there are going to be some themes that you were tested on step 1 that you will have to learn or relearn for step 2 CK. The reason why I say learn or relearn is because some of you may not have done step 1 prior to step 2 CK. Now, as the rules are changing and as it's going to be deemed that you should be doing step 1 prior to step 2 CK as a requirement, things will change. However, for those of you who are doing step 2 CK soon, the next year or so, do put your time into those difficult topics within step 1 that you may need to rehash out. Now, the depth of information is not the same, but some common themes will come up again. And as I recommend for any board examination, do a self-assessment early on. This will help you gauge a more realistic timeline for yourself, as well as also highlight the topics that you really do need to work on so you can optimize your time. And time is very important for these board examinations, so definitely consider doing that. With respect to resources, yes, UWorld is a very good assessment tool, but you have to use it as a study tool. I also really do enjoy learning from Amboss because they have built-in documents inside so that you can actually refine your studying while you're going through questions. Again, what works for you may not be what works for me or any of your other alumni. But these are just suggestions, so be patient with yourself and give yourself adequate time. Please be realistic with your time as well. Now, another thing that comes up frequently, not just for step 2 CK, but also for step 1, is the aspect of stamina, being able to complete a full block within your time, that 1 hour. As I've mentioned before, do be patient with yourself. Build yourself up to it. You'll notice that you'll have a sweet spot number of questions where you actually perform really well on them. It doesn't necessarily have to do with the content that you know at that point in time. It just has to do with your stress on the time. Like I said, build up to it. If you find that getting to 40 questions is not showing your adequate performance, you'll have to work on that. So come on back down to, let's say, 30 questions and see how you perform. See if that's more comfortable for you. And then build yourself up once you know you can whiz through 30 questions easily. You have to remember it's a skill. You're going to be recognizing a lot of patterns. So those are my tips for this Tuesday. Here are some additional tips from your other alumni. The following quote is from Dr. Aboabdo. There are many techniques to approaching a board question. One tip that tends to help a lot of people is to read the final line of the question prior to starting the prompt. This, for instance, can help with long prompts to ensure that all details are relevant. If a question ends with, "Which drug causes this side effect?" you can essentially ignore the rest of the prompt and look at his medication list and presenting complaint. Always keep the age of the patient in mind. I always start off the prompt by highlighting the patient's age as well as the patient's presenting complaint. With long prompts, you might forget how old the patient was or why they presented in the first place. To not get lost in the little details, always highlight the age, presenting complaint, and any abnormal vitals. This should help narrow down the diagnosis in your mind. When given a long list of labs, make sure to quickly skim all the values. It may seem like you'll save time in focusing only on the values related to the case in question, for instance, alkaline phosphatase and GGT in a patient with suspected gallstones, but you might miss something else that the prompt is trying to hint at if you only look at those values. It's always important to quickly skim the list, and although this might take time at first, as you get used to the normal range of values for labs, you'll start to be able to spot the ones that are abnormal even quicker come test day. Most important piece of advice I can give is practice timed blocks and practice them early on. The only way you'll be prepared for test day is by learning how to pace yourself through 40 question blocks. In my first week studying, I struggled for time and was usually randomly clicking when it came to the last 4 or 5 questions. That's completely normal. With practice, you'll develop your own techniques and get through questions quickly. On test day, you want to be positive and stay confident with your answer choices. You will not have time to revise most blocks, so get used to answering questions based off of your gut and not looking back to save time. It's a daunting thing to say, but it's very doable. Practice will make perfect. Best of luck and happy studying.